consumer brand, but we're not very well known in terms of our healthcare activities, and because that's more on the business side of Telus. We started in healthcare 8-9 years ago and have made a series of acquisitions over time to build up a significant division of Telus Health. And we provide a lot of tools to providers and to pharmacies and to hospitals and governments across Canada. And you know, we've come into healthcare thinking that we can solve some difficult and tractable problems in the health technology space. And I think we're uniquely able to tackle some of these, and I'll try to highlight what those are and then give you a sense of what our strategy is going forward. So the first issue is, you know, when you compare Canada to other countries around the world, we're actually not that advanced from a health technology perspective. You know, as an example, we're one of the last developed countries in the world to bring electronic prescribing into the market. We're years and years behind the Europeans, and we used to take comfort from the fact we were about the same as the US, but they've completely overtaken us now as well. So, you know, why is that? Given that we have a single payer system, people from outside Canada often say, well, this should be easy for you guys, you know, because you've got this, you know, government-funded system. But one of the real difficulties is that the guys who drafted the British North America Act, and on International Women's Day, I will say guys, maybe if it was women, it would have been done properly. But the decision was made at that point to put healthcare as a provincial responsibility rather than federal. And that has really caused a lot of difficulty because standards are done province by province. All the provinces are small, and we actually don't have a Canadian healthcare system at all. We have 10 or 14, depending on how you count, small healthcare systems, all of which have their own standards, their own approaches, their own funding mechanisms, etc. And that has meant that we have a very fragmented market. And with IT, economies of scale are extremely important. And none of our jurisdictions, not even Ontario, has an ability to achieve real economies of scale in something as complex as health IT. So one of the things that Telus is doing is moving toward you know, a national platform. And that brings me to the second problem we're trying to solve, which is getting standards for communication, particularly in community-based care.